So today we're talking to Jim Waite, who has been involved in the care industry for a little while. And as we've been talking about earlier, we're talking to people who are pivotal in the care industry. And I think what that means for us at Fulcrum is those people that are maybe on the periphery of the actual hands-on care and are not going in there and looking after people, but they are involved in what happens to those people and providing good care for them. So how did you get there? I know you started as an engineering degree in Cambridge. Where did you go from there?
I'm going to skip a few stages.
Fine, absolutely.
And start with how I started in care, but I call it health and social care.
Yeah.
Before I do that, I think there's one sort of completely not obvious thing that was actually, with hindsight, quite important, which is that my father, whilst he wasn't a clinician, ran a section of Boots in the 50s, actually I think starting in the 40s, before it was called pharmaceuticals, mixing compounds for chemists.
Oh my goodness.
Yeah. And that evolved into him working in the very early days of the pharmaceutical industry back in the late 50s, early 60s. And so I grew up with a lot of my father's friends being doctors. And so, I had more of an awareness than most people would have unless you been in and out of hospital in your youth, which I fortunately hadn't been, of how health and social care worked. The other thing that happened is that led to me starting in health and social care was I'd spent a lot of time in the retail world.
Okay.
Latterly, I'd worked in the Kingfisher Group, which you might remember as Woolworths, B&Q, Superdrug, all of those businesses. I was latterly finance director of one of the divisions, and a business called Westminster Healthcare, by that time run by Chai Patel, was looking for a CFO. And by number of sites and by some other measures, we were by far the biggest privately owned healthcare services group in the country. So when they looked around for a CFO, and they looked around for someone who knew how to manage put in the systems and processes you need to manage a large organisation, there wasn't really anyone already within health and social care who knew those systems and processes. We were something like 150 sites. That was huge by the standards of the day, but I came from somewhere which was many thousands of sites and an industry which has spent many decades evolving those kinds of systems and processes.
So you've got to the point that you're working in care, and then where do you go from there? Where do you go next? And why do you move on from that sort of role?
Well, I'd say the one other thing that's worth talking about around what you were just saying is if you think about some of the people you all have known over all these years, there'd definitely be some people who spent a bit of time in care and then bounced back out of it and it didn't really gel.
Definitely.
I think the thing which sort of appeals to a minority of more financially orientated types is that you've got to care. And as you were sort of putting in other words just now, it's not just all about the numbers. In most of these businesses, you have to trust that delivery of good care comes first. And if you deliver good care and you keep your eye on the bills, and you're not silly about your pricing, then the profit will look after itself.
It is. Putting the quality ahead of anything is the only way to manage either a large group or an individual care home. If the compliance isn't there, then the money doesn't come in, does it?
Well, and then you don't do good things for your service users. People aren't happy, but if you work it the other way around, then you find that people like what you do. You get a queue at the door, and then you just sensible commercial management, and you end up making money.
Yeah, and I think sometimes the care home managers themselves have to become business managers too. I think that's something that's changed over the years that I've been in care.
Yeah.
And have to work with people like yourselves to actually learn about the business and the marketing. Okay. So tell me a bit about what you're doing now.
So for the last I should know this number off the top of my head, but I think it's 13, 14 years, I've been running a small investment business where, for the first several years we were trying to make investments in health and social care and also in certain consumer businesses. This year we've decided to focus exclusively on health and social care, because certainly for me and for the team, it's kind of what gets us out of bed in the morning, what we care about.
My passion is care homes. And I think to understand, what we're trying to understand from these interviews is there are people like you that are actually doing it for all the right reasons, because of your passion and because of your understanding, and maybe, you know, that we're all thinking about the future and the future of care and how that's going to affect us and our families going forward. I'm probably at the age now where my I shouldn't say it on camera probably, but my mother's probably at the age when she's going to need some help and some care. And I think you do start to get to that stage where you look at how's the care of the future going to be. So with what you're doing now, how can you see the future developing? What's going to happen to the care home industry?
I think the body of care homes is going to continue in very broad terms in a very similar way. We'll still have care homes. We'll still have people who need a level of care which can only be delivered in a care home. I think there is, and actually you've been around long enough that you might be conscious of this, although maybe not had the time to stop and think about it, is one of the interesting international comparisons is that we tend to be, today still slightly over care homed per capita compared to a lot of the Western world. And if you go back 10, 20 years, we were quite dramatically over care homed compared to a lot of the Western world. And I think that just goes back to the Thatcher era of when care homes started, and some very effective mechanisms were put in place to suck in private capital to develop care homes, and it went very well. The upshot of that was that we've ended up with less care in the home, than less domiciliary care, as you were calling it, than many of our Western world peers with similar demographics. And it would certainly seem to me that there's an opportunity to further develop the care in the home. And I think with quite modest use of technology, and when I say modest, I mean technology which exists today, I think there's the opportunity to care for more people within their own homes than is probably done today.
Yeah, I think I do agree with you there. I also think technology in the care homes is going to reduce the amount of staff we need going forward in care homes, because I think we are going to be we're sort of on the way out of the staffing crisis at the moment, but we're using a lot of people from overseas, which is actually robbing Peter to pay Paul a little bit. We're getting people in we're getting nurses working as carers in our industry now, and we've got some really good quality people, but we are taking them away from there.
Yeah, I think I'd be personally, and I know this isn't a universally held view, I'd be cautious about saying we've brought in enough people, we've solved the problem, we can stop doing that, because if you look at the demographics of the country, there aren't enough young people coming through to populate all of the work that needs to be done, not just in care but across sectors.
Very true.
When I talk about consumer areas, I've worked a lot in retail, I've worked a lot in hospitality. Those, along with health and social care, those are the three big sectors that employ very large numbers of young people in this country.
Yeah.
And we don't have the demographics coming through to fill all of that. So I think we will need to continue to recruit from overseas.
Yeah.
The NHS took in well over 200,000 healthcare assistants last year. This is large numbers we're talking about.
Yeah, and we are too. I think what we've found in Fulcrum, when we are actually going into care homes now, they were using a huge amount of agency shortly after COVID, and that is reducing. they are starting to
less agency because of the internationals.
Yes.
I think if there's something which, from what I hear, one step removed, does need tightening up, is some of the upshot of unscrupulous use of the immigration scheme has been more cases of modern slavery being investigated, more people arriving, doing a few days' work and disappearing to who knows where.
Yeah, that's true.
I think if we can couple a tightening around all of that with continuing to bring in good quality people, I think that's okay. I'd sort of be with you. I have reservations about bringing in nurses to work as carers. For example, actually, you might know Peter Carter, who used to be head of the Royal College of Nurses.
Right.
So I quizzed him on this, and he says, sometimes we forget, and he always talks about the Philippines. He's got a Malaysian wife too, so this is, he definitely understands this, both from an immigration and Royal College of Nurses point of view. There are countries which train too many nurses. Philippines top of the list, with the intention of those extra nurses going and working abroad, so that they then send money home. And it's part of how they make their economy work. There are large parts of the Middle East and Africa where the average age is about 20.
Yeah, true. That's true. Yeah.
Very large families, lots of young people. Often with the economy not growing quickly enough to keep all of those people busy and well paid. Yeah. And so I think it's actually potentially a good thing that we take experienced and well trained carers. And bring them to the UK if they're living in a country which has a surplus.
That's true. And going back to the financials, because I know that's where the heart of care is with you, and the financials. Is it still a good investment? If I was to now think about investing in a care home, is this the time to do it?
In a care home, I think you have to be careful about where. I think you'll have heard this from other people. If you take a random local authority in the country and build a brand new care home, in fact, I think Langham Buisson publish this number every year, and you do nothing more than accept normal local authority rates, you won't make a return, an acceptable to anyone return on the capital that you've invested in building that care home. But you'll know from the work you do that there are plenty of new privately funded care homes being built, which is improving the overall stock of care homes in the country. And you'll also know that there are exceptions to that general rule of it doesn't make sense to build a care home. There are plenty of places where they're extending existing care homes with new good quality rooms. And there are some people who are able to work with the right local authorities and make adding new capacity work and get a acceptable return on capital. And this might surprise you, I'm not an advocate of those returns on capitals being racy. They just need to be adequate to attract funding into the sector.
Absolutely. It's been really interesting to speak to you, Jim. And I think I've learnt a lot. That's what it's all about. And I hope that the people that are watching this will enjoy listening to you too.